Okay, everyone. Good afternoon. This is a support call for hospice and home health agencies throughout Louisiana and Mississippi. Today, however, we will be focusing in on Region 4, which is metropolitan Lafayette in that area there. I want to welcome everyone who's going to be joining us for this discussion. What we're trying to do is make sure that patients, both home health and hospice patients, have greater safety during this upcoming hurricane season. And like I said, we will be looking at the coastal regions of Louisiana and Mississippi over the coming weeks. And today we're looking at Region 4, which is where patients are living in Lafayette, in the parishes of Lafayette, Evangeline, St. Landry, Acadia, St. Martin, Iberville, Vermilion, and St. Mary parishes. I want to thank not only the hospice and home health agencies that have joined us today, but also the folks, the emergency managers and parish managers in those regions for this discussion. As I said, each week we will be focused on a different region. Today is Region 4. Next week we will be looking at the Mississippi Gulf Coast. Just to give us some context, when we're talking about the Region 4, we're talking about almost a 500,000 people that make up Region 4. Specifically with regards to hospice patients, we know that we have about 3,400 hospice patients in that area, and last year, 2,400 of the Medicare beneficiaries in Region 4 died with hospice. That's about 53% of the Medicare population. And the reasons for enrollment you can see in each state we have it broken down. Circulatory is heart related. Nervous is usually the dementias, Parkinson's, and then cancer, and then various cancers. So those are the three top reasons that folks are enrolled into hospice. When we talk about these hospice beneficiaries, Medicare beneficiaries, you have to remember that when you're talking about home health, we're talking about three times as many. Although home health has probably only a third of the patients that are enrolled currently in the at-risk registry, two-thirds of those are hospice patients, but there are a third of those patients are identified as home health. There are still three times more home health patients in Region 4 than there are hospice patients. So my point is that we're talking about a lot of people who are in the health system, in the home and home care system, that are going to be looking for support throughout this hurricane season. And we're looking at Region 4, and we do have a designated regional coordinator for hospice. We don't have one for home health at this point in Region 4, but I think Dawn and Dave and Zach, are you all on today's call? If you can
I'm
unmute.
here on the call. I'm not sure if Dawn had made it on or
Okay.
not.
Okay.
I'm here on the call though.
And Zach, you and Dawn are handling hospice patient, hospice. Y'all are the contact person for hospices in Region 4, correct? And
Correct.
that's your correct email address.
Yes. And that's
Okay.
Dawn's correct email address as well.
Okay. And so, agents, if you're a hospice in Region 4, we want you to direct all of your questions and your concerns, especially during an emergency declaration, towards Dawn and Zach, and they will be working directly with the emergency managers in Region 4. We are looking for someone in the home health field in Region 4 to be that contact person. So if you're interested in serving as that person for all of the home health in Region 4, I'd ask you to please give me a call or drop me a line, letting me know of your interest so we can set you up and put you in contact with emergency managers in Region 4. We're looking for designated regional coordinators in many of our regions. If you're on today's call and in a different region, I would encourage you to consider becoming the regional coordinator for home health or hospice in your region. You'll be working with some fantastic people. Right now, we're focused on Region 4, and this is the regional leadership in Region 4. Dr. Stefanik, Doc, are you on today's call?
Yeah, sure am. Hey, how are y'all doing?
Thank you, Doc, for being here. We have Nikki Gilry and Danielle
Yes, sir.
Maples. Nikki's on call and Danielle as well.
Hi,
Um,
Jamie. Yeah, thanks for having us and coordinating this.
Thank you for being on today's call. Um, and so we want to look at hospice and home health patients that are living in they're not in a facility, they're in their homes, and we're caring for them in their homes. And hospice and home health are responsible for helping these patients um, develop a workable plan for their family members in the event of some sort of emergency. And we know that we call upon hospices and home health to be very vigilant about the practicality of those plans. Families think that they can do a lot more than maybe they will be able to do. It's important to try and connect these family members with other family members that can take responsibility for them in an emergency, or a neighbor, or a church group, or a civic group. We want people to have, especially home care patients, to have as much support as they possibly can without relying too heavily upon the region or the parish to handle that, because people are going to be a lot more comfortable if they are with their friends and their families than if they're going to be in some sort of shelter or a designated medical special needs shelter. We're going to talk about that in just a little bit. I want to remind everybody, every Friday we send reports to all of the emergency managers in every parish and all of the regional directors, and we rely upon hospice and home health to make sure that those lists are accurate. Every week I go through and I look to see where the holes are, the gaps are, and we currently have, as of Friday, we had 26 patients in Region 4 that the hospice or the home health forgot to assign a parish to that patient, and therefore those 26 patients were not included on last week's reports because no parish was assigned. So I want to ask you, hospice and home health, to make sure you're assigning the correct parish to your patients when you're putting them in there. All of the patients in Region 4, the zip codes were included. I do want to remind everyone that in terms of the birth field, the correct way of doing that is to put the year first, followed by the month, followed by the day. That's just an anomaly in the system, in the way it was set up. Now, in addition to the 26 patients in Region 4 that did not have a parish assignment, we had 71 patients that were included on the report this past Friday, but 78 were not reported, even though they're in the system, either because, the reason is because 7 agencies in Region 4 failed to do the weekly update that's required. And I'm really surprised that a lot of agencies don't realize that the at-risk registry requires that you do a weekly update in order to make sure that the patients that we're sending out on Friday to the emergency managers is accurate and correct as possible. These are the 7 agencies in Region 4 that made my wall of shame this week because and I know last week was the extended Memorial Day holiday, and that may have something to do with why these patients were left off. But there were 78 patients that did not make last week's list because they were not updated. And if an agency it does not know how to do the weekly update, please call me. I'll be more than happy to walk your staff person through that process to make sure that we can get these reports as accurate as possible. We send out a reminder every Thursday morning to all of the users, reminding them to do the update before the close of business in order to make sure that those reports are accurate. If your agency is not receiving a reminder, please let me know and we'll make sure we'll clear that up. And then I have some general websites that agencies might want to use. As I've gone to regional meetings after regional meetings, it's pointed out that there are lots of sources for information today. Some of those sources are credible, some of those sources are not credible, but these are what we consider to be the official sources for weather and emergency declarations. As hurricanes.gov is a very important alert system or website that you can go to get accurate information about any tropical systems in the Gulf. So I am going to stop there and I'm going to open it up to the emergency managers in Region 4 to lead us through any discussion that you would like to have with the provider community with regards to how we can help you do a better job of making sure that patients are safe this hurricane season. Dr. Stefani,
Yeah.
does anyone have slides that they want to that I can let you share your
No, I don't think there are any slides. I can tell you all just real quick the overview. Hey, so I'm Tina Stefanski. I'm the medical director here in Region 4. I have a great team and y'all just met met Nikki. Nikki's on, Nikki Guillory, Sheila Hudson LaSalle, and Bally Miller, Carol Broussard. We all work together on lots of other initiatives, but during hurricane season, of course, a lot of focus on those plans. On the call too is Edie Amon with 232 Help 211. So there's Edie. And a couple of our emergency managers. I'll see who's on in 1 second. I just want to give y'all a big overview, right, of what's happening in the region, what the plans are, which really haven't changed much. So y'all know we're an at-risk region, so there are no sheltering plans pre-storm, no medical needs shelter plans pre-storm. So we know we have a lot of parishes at risk. So for individuals, especially those who you care for, who are vulnerable, power outages are a challenge for those individuals, which they often are. No matter what parish you live in our region, your patients need to have a plan to evacuate. The state-run shelters really should be considered kind of like a shelter of last resort, right? Although that's how we call them. We really want people, James, you said before, if they've got family or friends who are able to care for them, take them with them when they evacuate, or plan to evacuate to someone else's home further north. And that's because these shelters, if you think of a big open setting, we won't have a shelter open here. We typically try to send our shelterees to Alexandria, to the mega shelter there. If that shelter is full, then we oftentimes will go up to Shreveport or maybe even Baton Rouge, just depending on where the storm is headed. But it's a big open auditorium with cots. And that's of course, keep people safe. And we all try real hard to keep people comfortable, but it's hard on those cots, especially the patients that you're talking about. There's not like there's a distance to go to the bathroom. So while they may be okay at home, incontinence is a big problem. So y'all can just think forward, right, on that issue on a cot. People have breakdown. There's, I think, a misconception sometimes that it's this great shelter with a lot of nursing staff, and it's kind of like, little facility in the shelter. And again, we do have nurses, but these are health unit nurses. We're not used to caring for these for individuals with the needs that your patients will have. So I say all of that to say, please work with your families to come up with another plan. But of course, the state-run shelters, if they're open, are there to help and support to support your residents.
Doc, let me just ask you one
Mhm.
question. In terms of if a patient goes there, they need to have a caregiver accompanying them?
Thank you. Yes. So we know there's certain situations, some people don't have anyone, and we fully understand that. And so, we will work with those people. But for everyone else, they need to come with a caregiver, because so I'm saying the staffing is limited, right? And we need someone who knows that patient's,
Absolutely.
regimen, and they of course can be more comfortable. So yes, need to go with a caregiver. I'll say to you, to home health and hospice agencies, if your clients are in a shelter, and then storm passes, safe to travel, we will be asking y'all to come and make visits. If they can't go home right away, make visits in the shelter setting. And I think y'all can get paid for those now. I think that might have changed. I'm not sure.
Part of the reimbursement system already there, that if
Perfect.
they're
Yes.
receiving reimbursement, it's expected that they will continue to see patients in those shelters.
Okay, great. So we get
Or,
all that
or
information.
make arrangements for another agency in
Okay.
that area to contract with them to provide that service, that support.
Okay, perfect. Thank you. And also for y'all to know, if we have a discharge planning team, if that person can't go home and they're gonna evacuate and they're gonna, but they have somewhere else they can go until maybe they can get back home. If their home is significantly damaged, we reach out to the home health agencies, hospice, to tell y'all, hey, this person's gone. They're going to cousins up north in Shreveport, or they're coming to Lafayette, because they can't get to their home in Abbeville. Can y'all help make arrangements? So we do that as part of the process. I'll talk about the evacuation side. So just for y'all to know, so while the at-risk registry is a tremendous help, so please continue to update it. That is only, it's just to give awareness to the OSEF directors. I don't want there to be any misconceptions that, hey, if you put a person on your list as needing assistance to evacuate, that means like you can wash your hands and someone's going to come and take care of that patient. That is not going to happen. That is for you to know, like, okay, these are my top priority patients. They're going to need evacuation assistance. Let me go reach out to them again, make sure nothing's changed. If they don't have a good plan now, and if they don't, really, I think you need to be calling Nikki, Sheila, who are both registered nurses, and saying, hey, my 2 or 3 patients, we need some help. Let's help me talk through it. So if a storm is coming, that's really what I ask y'all to do. Work with the families that are in need, see if they have something's changed, and maybe they don't need assistance anymore. They've got a place to go. If they need transportation, I'll talk about that in a second. But for those few that really really need some help, I would ask that y'all call us a couple of days before, so Nikki and Sheila can start talking through options with y'all, before, like, it's critical.
I guess we're talking about all the patients in Region 4, but especially Vermilion, Iberville, and St. Mary, where you have these coastal region where storm
Yeah.
surge, those
Right.
patients that are most vulnerable to storm surge.
Right,
Or,
but correct, but know that even if you live in Lafayette Parish, right,
yeah, yeah.
or St. Landry or
The
Evangeline,
rivers rise. Yeah.
well, and power outages. I mean, that's really when we start to see problems, is when there's extended power outages. So power is a big one. So sure, Iberia, Vermilion, St. Martin, we think is our more coastal. Iberia and Vermilion really are kind of our top 2, we think, of concerns. But really, if you've got a person who y'all know doesn't have a generator at home, they need electricity to survive, and like if the power goes out for 3 hours, they're going to be in a bind. Those are people who need to be on your radar too. Like, even if they live in Lafayette, we're not expecting to get the impact, but if you're hearing from your emergency directors that power loss is a possibility, be thinking about them too. The only other thing I wanted to talk about is transportation. So in pre-storm, ambulances are incredibly limited. Post-storm, there may be federal contracts, and we don't know on the federal side what's going to change this year, okay? So we might not have resources, and we've been in plenty of evacuation situations where we don't have any ambulances for people to evacuate, because the whole southern coast might be evacuating, and so they're even more limited. So I'm saying all that to say, when you work with someone and you put on that at-risk registry transportation type ambulance, that should only be those people who cannot go into paratransit. They essentially are laying flat. If truly bedbound individuals, so we often say, how do they get to their doctor's appointments? If they can go in a paratransit or in a car, then that's not an ambulance transport. So please be very careful about putting ambulance on that list. And the last thing I'm going to say is so Nikki and I were looking, Jamie, at the at-risk registry before, a little bit earlier. And so we noticed, at the top in green, you have those, or I think it's green, but I'm not sure what color. At the top, you have those needing assistance to evacuate, where y'all check yes. But at the bottom, y'all have people on your lists, and it's across kind of several different agencies, that where you may have like, Joe Smith doesn't need assistance to evacuate, but you look at transportation type and they have ambulance. Well, how's Joe Smith going to get out if he truly needs an ambulance to his family member, in Alexandria? That's someone that needs assistance. So, just wanted to bring that up.
In those reports that you're receiving, those weekly regional reports, if it's green, it means that the agency updated those patients
Oh,
this
gotcha.
week.
Okay.
If they're gray, it's that we don't know. And we
Okay.
don't know why they're still in there. The agency hasn't taken them out, but the likelihood is that the agency forgot to update them that week. So we still want y'all to know about all of those patients. Like I said, we had 72 that were updated this week, but we had another 78 that were not updated, and
Okay,
that's. But I
That's
want
the
everybody.
colors.
I
Thank you.
want you to. I want you all to know that those patients are still there, and I've been.
Okay,
We
great.
just don't know why they're in the registry.
So that's it. So, Nikki and Sheila, could y'all put y'all comments, y'all contact in the chat, please, just so everybody knows how to get in touch with Nikki and Sheila. Again, those are, they're both registered nurses, and Bally, of course, also works with us in emergency preparedness in our office. But Nikki and Sheila are registered nurses, so I think they're going to be your contacts a couple days out before. If you got one or two patients who you're really trying to figure out a plan, I'd ask that y'all work with Nikki and Sheila. So the OSEP directors, I'm going to look, I'll kind of run through the parishes and see. So first of all, Danielle Maples represents the hospitals. Danielle, I saw you on.
Yes, ma'am, I'm here.
Do you have anything that for the group? I know I don't know if there's anything in particular you need to tell this group. I just wanted to offer that.
I don't.
Okay.
I'm here available to answer questions and support as needed. Thank you.
Thank you. And so I'll mention this too. In years past, if we had some patients that needed to shelter in a hospital, we were able to do that. I just want y'all to know that that is really difficult these days. It's, hospitals are operating, you'll probably realize that, right? Staffing, and all that is a huge issue. So it is almost impossible to shelter a patient in a hospital now. So again, just let y'all know that kind of in the back of your mind. But I mean, we'll do our best if it's an urgent issue, but just FYI.
Having said that, I'm wondering in terms of a patient that is quote actively dying or
Oh yeah, well,
going into the active dying phase, and all of a sudden the hurricane's we're a hurricane's 3 days out, and the patient start. Should hospices? What are the options in Region 4
they
for
need to
those
get in touch.
particular patients?
Y'all need to get in touch with Nikki or Sheila, because those are the kind of patients that we're going to do our best. And our hospitals are great people, right? They're very caring. The staff that work, so we will try our best in that situation to try to find a space somewhere in the region and to find a shelter
Thank you.
in a hospital if we.
Thank
Yeah.
you. In other regions, we've tried to make it where the hospice, especially a hospice patient that has to get a patient into a hospital because they are going into the active phase of dying. Usually, we will ask the hospice medical director to admit that patient into the hospital that they have privileges in.
Yes.
Should that be
Yes,
the way?
100%. And that was, as I'm saying all this, I was thinking some hospices are off or kind of connected, or there's some kind of working relationship with the hospital. So definitely your medical director should try to get that person admitted. If they're actively dying, those individuals probably meet admission criteria. And so that'll be a little bit different than some patients that we're just trying to shelter.
In other regions, we are putting those patients in under the respite benefit,
Gotcha.
so that there is a reimbursement to the hospital for that patient. I don't know if Region 4
Yes.
will be adopting that, but there is a reimbursement mechanism for such hospitalizations.
Yes, definitely. And so thank you. That definitely should be your first option, is get your medical director to try to admit that person into their hospital that they're connected to, where they have privileges. Ashley LeBlanc is kind of our regional OSEP coordinator. Ashley, you have anything that you want to say? And then I'll kind of go through the parishes.
No, not really, but thanks, Tina. I'm just here
Okay.
to support as needed, especially if anyone has any issues reaching any of the OSEPs in between during an emergency.
Okay, perfect. Thank you. So Ashley was formerly the Katy Parish OSEP director. So Caitlin, are you on by chance? Okay, so y'all have a great OSEP director in a Katy Parish, Caitlin Saunier. And again, if y'all need to know any of this, you're welcome to reach out, but you might also be able to find it on by doing a Google search, but Caitlin is our Katy Parish OSEP director. Evangeline Liz, are you on? Okay. Iberia, Brandon Miguez.
Yeah, I'm on, Doc.
Hey, Brandon, I don't know if you have anything else. Brandon's a new OSEP director in Iberia Parish is great. And so I don't know if you have anything else to add to what I said.
No, just reiterating what you said. I prefer not to find out about somebody, during the 8 hour sequence that they need help, but that's it.
Thank you.
That's
Yeah,
why I want to really encourage all of the hospices and home health to please keep the at-risk registry your patients updated each week, making sure that the list that we're sending is as accurate and correct as possible.
and so as you're saying that, Jamie, I wonder is there a list of home health agencies that you maintain with a good point of contact? I just want to make sure that we have the right point of contact.
Yeah, I have one that I put together for Region 4. If you'd like, I can send that to
Yeah.
you.
Thank you. And I know
Okay.
you shared that with us in the past, just to make sure it's still most current.
Yeah.
And so for y'all to know home health, like when you're working with a patient, we rather you call us. Don't tell the family to call us. A couple of days before the storm, we ask that you call us and tell us what's going on. I mean, it'll probably we'll get to the point where we're working with that patient and their family, but at first we need you to call and kind of fill us in on what's happening.
And
Don't
don't wait until the storm to call.
No.
You need when you're enrolling those patients into your program and you're seeing that they would need assistance this hurricane season because of whatever because they're living alone without a caregiver or the caregiver is incapable of doing this and you can't find anybody else to handle that or they don't have the financial means or they're just plain stubborn. Those are the 4 reasons to put them into the at-risk registry so that emergency managers are aware of their situation.
And Sheila and Nick, you're going to be calling our home health agencies and hospice agencies just to talk over the next couple of weeks about what's on your registry, some of the patients that y'all are most concerned about, so that they've got some concept of things. So live here, I'm not sure if Chad Saunier or Jennifer Landry. Okay. St. Landry Van, I know Van Reed is on. Hey, Van, anything else to add from St. Landry's perspective? And we can't hear you if you're talking. Okay. Van, if there's something you can put in the chat. I just want to say we have a great group. I couldn't say so much about each one as I'm calling names. We have a super group of OSEP directors. So just for y'all to know, we have a lot of support. St. Martin Terry. So Terry Gidders in St. Martin. Vermilion Homer. And that's Homer Stelly. Okay. And in Vermilion, they work real closely with Abbeville General and their emergency preparedness plans for the medically complex individual. So I don't know if you have any questions for us. I do want to say that the process for the general public, but again, we ask that y'all help your patients. But for the general public who doesn't have a connection to home health or hospice, if there's an evacuation, suggested or called, 211. So Edie's group take those calls. So we tell everyone, hey, if you need help trying to figure out where to go to evacuate, you need shelter information, call 211. When 211 gets a call, if it's a person with any kind of medical issue, they're going to send them to us, LDH, and we man that triage line and we try to figure out what's the best plan for that patient.
I have one question on the GOSEF's website. It listed St. Mary as part of Region 4, but it's actually part of Region 3. Is it there's a part of St. Mary's Parish that may be part of Region 4?
Yes,
It's just that little peninsula out there near the coastal region right under Iberia.
yes, it falls under Region 4. Yep.
Okay, so home health and hospice patients, you need to remember that if they're in St. Mary, well, if they're in, you just mark them with St. Mary's Parish, but they may be part of Region 4's.
Well, and it's funny, for LDH, it doesn't. So for LDH, that's part of Region 3, but we know part of St. Mary, like Morgan City, often kind of considers himself part of Region 4 and evacuates this way. But just technically, I guess speaking.
Do we know if there is going to be, is there a threshold with regards to evacuations or mandatory evacuations in Region 4?
No, I don't think, I mean, that's a loaded question. I'll ask the OSEP directors. I don't want if they want to clarify, but no, it depends on the nature of the storm. I mean, I don't know if you have anything else to add. I don't think there's like a definition other than depends on the
No.
nature of the storm.
No, it depends on, every storm is
Different.
really, specific, because you're dealing with tide, you're dealing with rain, you're dealing with surge, you're dealing with a whole bunch of variables.
Are mandatory evacuations called by the individual parish
Yes.
leadership? Okay. So that's agencies that are servicing Region 4. You need to be aware that where your patients are and what the parish leadership is calling with regards to those patients. Okay.
Yeah. And I'm not sure. I know Brandon, don't y'all have a system? I know you've got some kind of a notification system that people can sign up to, right?
Yes, Iberia Pins is our notification system that we use in the parish to notify of basically anything. Severe weather. I did a mosquito aerial spraying notification this morning. So
Hey, so how do they sign up for that, Brandon?
It's I could actually I can email it to Jamie if
Please,
if that
yes.
works.
Yes.
Send me that information and I will disperse that.
And we'll do it. We'll collect every parishes and send that to you, Jamie, because I know
That would
Lafayette
be
Parish
great.
just debuted a new one last week.
That would be great if we could get a list of all of the alert systems so that I am constantly encouraging agencies to help their patient, not only their employees download those and sign up for those alerts, but also help their patients sign up for those alerts as well.
Okay, perfect.
I
So
just send it, Jamie.
Thank you. I appreciate that.
Hey, Tina,
yeah.
for the few parishes that do not have their own setup like Iberia and Lafayette does, most of them also utilize the state's system through IPAWS, which is RAVE, where it's basically just a push. So they don't have to be signed up, but if those parishes do push out emergency alerts through that system, it's basically GPS or geofenced within their jurisdictional area. So any resident or individual with a cell phone, the radio, the TV, depending on how they tag it to be pushed, will still get that information as well.
Okay, perfect. So Ashley, do you know of any other parish besides Lafayette and Iberia that have a subscription kind of deal where you can join?
I believe Vermilion does as well.
Okay.
I don't think St. Landry does. I think they use the state system as well. I'll try to help you double check though, Tina.
Okay, perfect. Thanks, Ash. I appreciate it. And hey, speaking of St. Landry, Jamie in the chat, Van's, Mike isn't working, but he's wants to make sure the group knows that they rely heavily in St. Landry Parish on the at-risk registry and appreciate the work, Jamie, that you do. And look, yeah, so he's got St. Landry's alert. Jamie's in there, so we'll get you the others, and maybe you can just send one email out.
That would be great. Do any other managers want to make any other comments before I open it up to hospice and home health to start asking questions?
Hey, Jamie, this is Danielle Hospital, ADRC.
Yes, ma'am.
I haven't heard it mentioned, I don't believe in the call. And I just want to remind folks that when planning, if you do think you're going to utilize evacuation and you may have a bedbound patient, most parishes will use Acadian Ambulance as their contracted evacuation partner. We just want to remind our friends in those respective disciplines that Acadian has protocols in place. Once sustained winds reach 40 miles per hour, the wheels will not turn on those ambulances. So, knowing that both in planning and then after stormfall, should a patient decompensate, unfortunately, of their condition, those calls for those transports are going to be put on the back burner until conditions are safe for those personnel to be out doing those transports.
Thank you, Danielle, for that. And also, I want to remind agencies that you have to make sure your patients, if your patients are planning to be picked up by Acadian or any agency to be brought, they can't. You have to make sure they don't change their mind when the ambulance gets there to pick them up. We've had that situation spring up in other regions where the patient wanted to be on the at-risk registry. They were put on there, and the ambulance showed up to pick them up, and they said, "I'm not ready to go. Come. It's 3 days before landfall, and we're trying to get people to safe spaces, and they get there to pick up the patient. And the patient says, I'm not ready to come back and pick me up tomorrow." And it's like, no, that's not how this works. And agencies need to really hammer this in with your patients that if they're going to be on these lists, they need to be ready to go when the parish or the region is capable of transporting them to a safer location. Any other managers' comments before we're going to move to agencies? Zach, you're the hospice DRC for Region 4. Are there any things that you have, any concerns that you have right now with regards to being that contact person for hospices and the region? Are there any questions that you are being asked by other agencies to address?
Nope, I haven't been asked any. And I'm serving primarily as like the backup for Dawn too. She's been kind of doing it longer than I have, so I'm kind of like secondary to her.
Okay.
Jamie, I'm on.
Go ahead. Go on.
And basically, like, I get calls about patients who are not on the registry because they were not identified, due to agency fault, due to patient changes their mind, and so their plan falls through. And of course, those are the tough situations that we always get hit with in the midst of things. Where I'm calling Tina's office and grabbing resources.
Right.
It hasn't happened in the last couple of years, but I can tell you many, many, many times after Katrina and Rita that I was stuck in a bad situation because patients changed their mind. So we can just plan the best as an agency and try to move forward, but you're gonna have those older patients who are stuck in their ways, and at the last minute they're in panic mode. So it's just unfortunate. It does happen, and it's particularly in the lower lying parishes. Lafayette, we have a lot of issues with power, with oxygen, patients on power, and need power. They own oxygen and have no generators and those things like that. So those patients are just as much as at risk as a lower lying parish as well. So I get calls like that as well. Nobody thinks about, oh, I don't have power and now my oxygen is only going to be good for 2 days. Now what? Well, you have a problem. So I get those calls as well.
Dawn, thank you for that. It reminds me I want to remind agencies, both home health and hospice, anytime one of your staff members, one of your clinicians, one of your professionals goes into a patient's home during hurricane season, they need to be talking about the patient's plans for that hurricane season, because things do change. But
Yes.
I think the more conversations that we are raising with our patients, the better chances of that plan formatting before we get into a scenario where the storm is out in the Gulf. As much if we can have these conversations every time one of your, whether it's a CNA or your chaplains or your social workers or your nurses, or who's ever going into the patient's home, that clinician should be talking about the plans, that patient's family's emergency plans for this hurricane season, especially in those vulnerable areas, those coastal parishes.
Yes, because it changes. And so in our agency, we start having those conversations and we put communication reports in the charts. And that starts April, May, somewhere around there, that we revisit all of that again, that we've already revisited, the previous year, maybe, if we still have that patient, but regardless, we make a habit of doing that because it does change.
I want to encourage agencies to adopt that best practice, to constantly talk about emergency preparedness, especially during hurricane season. You should be doing it every time you visit, because hurricane season is one of our biggest hazards, but it's not our only hazard in South Louisiana. So we need to make sure that patients we want to try and bring greater patient safety to home care and hospice patients, especially this hurricane season. What do we have any providers that have specific issues that you're facing right now, or with a patient, or you're having a dilemma with a patient as we start? The peak of hurricane season is going to be here before you know it. Within 60 days, we will have the peak of hurricane season, and but these questions need to be addressed long before the peak of hurricane season. So, if you're seeing a situation now in your agency that is causing you to stay up at night, let's talk about it right here. You would have to unmute yourself to ask the question, or put it in the chat box if your mic is not working. You said something about O2. Are there going to be places where O2 canisters in Region 4 where you can exchange? I guess I'm thinking either before or after the storm. Are there
Yes.
places where you're going to have exchanges?
So we hope to have some oxygen tanks available for community oxygen exchange, particularly if we're impacted. So I think post-storm, kind of like the ambulances, we will get more. We will get those things in if we were to be impacted, which we hope not to be, right? Pre-storm, we have a few staged. So again, if you have a patient who fits that and says, hey, they can get out of town, but they need some oxygen to make the trip, their concentrator battery, they don't have one, doesn't last long. I don't know, because I do know that there are some batteries operated concentrators. But yes, so back to let us know if you have a patient that's in a bind. We can help with pre-storm. There won't be an oxygen exchange site, but we could help with those few patients who might need some help getting something to tide them over. Post-storm, if we're impacted, we have plans with the parishes.
Yep.
And pre-storm, I know y'all know this, prescriptions, make sure your patients have, if it's not time for them to refill their prescriptions, there are exceptions that allow pharmacists to refill early to make sure that they've got, we say, at least a week, a couple weeks would be great, but make sure you don't forget to work with your families to get their prescription meds.
Yeah, we were suggesting at least 2 weeks of
Yeah.
medication that all through hurricane season that you make sure your patients have at least 2 weeks of medication at any given time. I was talking to our agency not too long ago, and they were thinking 2 to 3 days of medication. It's like, oh no, no, no.
So,
That needs to be a lot bigger than 2 or 3 days. Yeah.
Yes, and they should be able to do that.
Any questions for the regional experts, or the regional managers, I should say? None of us are experts at this, but we're trying to manage a very hazardous and vulnerable population through this hazardous period.
Edie, you have any questions? I know this is kind of a learning thing for you, because Edie's has some interest in trying to help us work, with some, our most vulnerable, so I don't know.
Thank you.
No, I don't. I'm in the process of scheduling meetings with all the SEP directors in our region, just to get their HR plan. We've got ours started, just to kind of see, make sure, because I know everybody's going to activate at different times. So just to make sure we're all kind of in sync with that. No, but I'll be in contact with you, Dr. Tina, for anything that pops up. Thank you, though.
Yeah, thank you. And Nikki's our emergency preparedness director, coordinator for public health, and she also comes from the home health setting. Nikki, anything else that we need to add to this?
No, I think you touched pretty much everything. The
Yeah.
only thing is just to remind people when they're entering into the at-risk registry, just make sure that the information that you're submitting, it makes sense, right? So like the ambulance, what diagnosis are you putting to need the ambulance? Because like we looked at diagnoses and they have hypertension or, coronary artery disease. You just want to paint a clear picture so that it makes sense of why they need the ambulance services. It's not necessarily the diagnosis that you're using for home health. It's probably more the mobility diagnosis that you want to put in there so that it populates on all these forms, just so to give us a better understanding of why that patient needs an ambulance.
And also, whether or not they have pets in the home. I think
Yeah.
that's also another issue that, we face, that you don't face in an acute care facility, but we do. There are pets there, and something has to be done with those pets. So agencies, you have to identify those pets. And you do that in the registry. Yes, are there pets in the home? Yes or no?
And y'all know we don't want anyone to not evacuate because they're worried about their pet, right? That's the last thing that we
Yeah.
want. So there are plans in place to, if you can't find a place for the person's pet, again, we're all working on plans to take care of pets, shelter plans, through the state. So please don't let that be a barrier to evacuation for anyone.
Any questions? Okay, well, I'm very happy that people feel that the questions have been answered. I'm hoping that we have a very quiet season, that that we don't get tested this particular year, especially with all of the changes that are taking place in terms of the emergency response and the absence of FEMA this hurricane season, but we will be here to help you through it. Remember, Dawn and Zach, or for hospice, Dawn and Zach, or your contact folks
it's for
in
both.
Region 4.
It's for both. It's for both, Jamie.
I'm sorry.
It's for both. I'm the home health and the hospice. So
Okay. So thank
yeah,
you.
you can
Thank
give
you.
everybody my information. I
Okay.
have no
Okay.
problem. I do not mind helping answer questions, and
Thank you.
maybe that way I can go to Tina and them's office if I can't figure it out. But
Thank
Yeah.
it's not my
Thank
first
you.
rodeo.
No,
you.
I was gonna say it's
Thank-
definitely not, Dawn. We appreciate you.
Thank
No,
you,
I've
Dawn.
been doing it a while.
Thank you, Dawn. I appreciate you taking both
Yeah.
home health and hospice.
Yeah.
And I will get the rostrum of both home health and hospices out to Region 4 managers. Who asked for that?
I know Tina asked for an update.
Well, we're gonna get, so we'll put together, Jamie, all the parishes, their
Okay.
the OSEP director's name, and then also the their alert systems.
Okay, and we'll get you a list of home health and hospice
And
agencies
the
in.
lead, correct, in each,
Yeah,
in Region 4, so we can make sure the point of contacts are the same
right.
that we're using.
What I will do is I try to include agencies in Region 3 and Region 5 as well, because agencies from those regions also service
Yes.
patients in Region 4. It's about where the
Yep.
Yeah, so the agencies may come from outside the region. So I'll give you a complete list of all of those agencies on either side of you as well.
Okay,
Okay.
perfect. And hey, Dawn, a quick question. You used to be Dawn Miller, right?
No, Dugas, LeBlanc, Dugas. No,
Okay,
she's
yeah, I
at
don't know.
Complete. Dawn
Okay.
Miller's at Complete, or used to be.
Yeah, okay, I'm not sure what
Everybody
this is.
mixes this up.
I know, so I think we, yes.
Tina, hey, this is Danielle. Dawn Miller is our nursing home DRC.
Yes,
There you
that's what
go.
I'm looking at, yes. Thank you.
And that's another thing I need to say. Agencies, home health and hospice agencies, do not put any of your nursing home patients in the at-risk registry. Nursing homes have their own emergency plans for those patients that you're servicing in those nursing homes. They're responsible for them. Please do not put a nursing home patient into the at-risk registry. Thank you, Anna. Thank you for saying that.
Okay, hey, my little snafu helped.
Yes,
Let's
yeah,
up on the
thank you.
discussion, thank you.
Thank you. Okay, well, listen, I appreciate, if anyone has a question, please ask it now. Otherwise, I appreciate your time and the efforts that you're putting into this hurricane season to make sure that patients are safe and families are safe. So we thank you for all of those efforts. And if you have any issues, please talk to Dawn or to Zach. And if I can be of any assistance, please don't hesitate to contact me as well. We will be meeting again next Wednesday, like I said, and we'll be looking at the Mississippi Gulf Coast. So feel free to join us if you want to, if you want to hear about the plans in Mississippi as well. So thank you.
Thank
Take
you all
care,
for
everybody.
everything you do.
Thank you.
Thank you.